the decision. When you've lived with an animal for 16 years, it becomes quite challenging to decide when is the time to let go. Talia and Thor came to us 16 years ago. They've had a really good life. They've traveled. They've been to Hungary, to Italy, Slovakia, Norway. Where else have they been? And New York. They're wonderful dogs, loving dogs. But now they're 16 years old, and Talia has pretty much stopped eating for the past 2 weeks now. She still occasionally will take a small amount of dog food or a slice of bacon, but pretty much you can tell that she doesn't really want to eat. She's had a lot of treatment, a lot of pills and injections and medications. Her teeth are not in good condition. There's an infection. She's been on antibiotics for those. But you can't really work on a small dog's teeth because of the great risk that if you anesthetize the dog, it won't wake up. This may be one of the factors, but I think there may be another factor as well. That's why for the past week or so, she's been on different pain medications. She has a mild case of Cushing's disease, like her brother. His is much worse, which is being medicated. She has Legg-Calvé-Perthes disease, which is a congenital defect of the hips, which fortunately doesn't seem to be giving her much pain. And that's really one of the questions. How much pain is she in? Border Terriers are notorious for being resolute, for not showing pain, for not whining or indicating that they are in pain. So it's been quite tough, but I think after living with this little dog for 16 years, I can tell when she's not happy, and she's starting to get that way more and more. I think the administration of some of the new pain medication is helping. This medication is, there are two forms. There's a tablet and there are drops. Giving her the tablet is a real challenge because she's very stubborn. She spits out the tablet. You try to force it down her gullet and her little tongue works and her jaws clamp, and she just doesn't want to take that tablet. Hiding it in food was great while she was eating, but when she's not eating, it's difficult. The drops are easier because I drop those onto her tongue and she has no choice. Fortunately, the pain medication does seem to make her life easier. She can still walk. That's important, because one of the things I'm assessing every day now is how well she's reacting to being taken outside. I'm fortunate that I work at home, so I can be with the dogs almost all of the time and take them out when they need to go out, and sometimes I'm a little late and I don't get to take them out in time, but I try to take them out 3, maybe 4 times a day. And Talia, it's clear she can't walk long distances comfortably, but when she is out, she shows interest. She sniffs around and she follows her brother, and she squats down to pee and doesn't seem to be having any troubles with doing her business. But it's a chore, and now we're heading into the coldest part of winter, it's increasingly difficult. She does have a warm winter coat, which helps her ease some of the chill. But it's not easy for a little dog, particularly when you see how skinny she is. A few months ago, she weighed around 10 kilos. Now she's down to 7 kilos. Which brings me to the decision. Very soon, sooner than I might like, I have to make the decision about when to terminate her life. That means it needs to be not too early, but not too late. Too late would be letting her suffer more than is necessary. And I think that's the governing factor. I can't allow myself to be selfish in my choice because, of course, like any pet owner, you want to hold on to your pet for as long as you can. And that is selfish because it's about keeping the loving companionship of a beloved pet. And of course, I'll certainly miss her when she goes. It probably won't be very long. But I'm sure I'll get over that. The key here for me is allowing her to suffer a little, but not too much. Because, as the Buddhists say, life is suffering, and life is such a precious gift. It's something which you only get one of them. And those who know me know that I'm not really a religious person. When I'm asked, do I believe in the soul? I say, yes, I do believe in the existence of a soul that starts to grow when we're born and ends when we die, because that soul is all our experiences and who we are. And the same applies to little dogs too. They also have their own soul, which is made up from their experiences, made up from all the things that happen to them, good and bad, that condition their behavior, that govern how they respond to the world. And Talia has always been such a sweet dog, such a charming dog. She is really quite remarkable, and yeah, I'll miss her when she goes. But that still leaves the decision. Important advice: talk to your veterinarian. They deal with this all the time. I've spent a lot of time over the past months and years visiting veterinarians, both here in Austria and in New York, and even in Boston, trying to get these little dogs well and to keep them well. And I think they've done quite a good job in helping to solve the problems these dogs have had. Their health has generally been very good. A little bit of problems with canine epilepsy, but they passed after a few years ago. And then there was the diagnosis of Cushing's disease, which was starting to cause some problems and still does, but that can be managed with medication. Ultimately, though, you have to make a choice. You have to say, this is the point which is reached when it's time to say goodbye. And it should be done in a way so that there is no stress for the animal, in a way that they feel comfortable, that they are pain-free as much as possible, and that it is done in a respectful way. So that's the decision. We'll see what happens as we engage upon this adventure in the next days, or maybe weeks, as she continues to refuse to eat, maybe she's making that choice too. So, to those of you who face a similar decision, I say, remember, it's not about you, it's about the dog. What is best for the dog? What is best for your cat? When they reach the point that life is no longer worth living, when every movement is a chore, when there is a constant background hum of pain, then maybe it's time to say goodbye. Talia hasn't quite reached that point yet, but I don't think she's far away. So, let's see what happens. Thank you for listening.